Good morning, everyone. Welcome back to my YouTube video channel. I just want to show you some of the quick video of patients we serve around the community here. Many of them from young kids to adults to elderly to medical healthy patient to medical compromised patient. Today is a quick video of how the deep cleaning look like. This is an example when a patient haven't seen the dentist for more than 5-10 years. A lot of plaque built up, a lot of calculus built up intraorally. You can see from the x-ray, as well as you can see from look at the clinical case. But basically we numb the patient really well. The idea is to break up all of those hard calculus that stuck interproximally between the two teeth and as well as under the gum area. And basically once we break this up, there's a lot of bleeding coming out, which is normal because of the problem is the infection. That's what happens. If you don't have infection, when we do cleaning like this, there's no bleeding. But when you have a calculus that would contain bacteria, when we clean it, there is a lot of bleeding coming out. What I'm saying is, I'm not saying it's normal. What I'm saying is, it's common to see the bleeding when we do this because of the infection. Okay, just want to make sure you understand. It is not normal, but it is common that you see the bleeding when we do the deep cleaning. So I just want to emphasize about that. And when we do that, we actually numb you really, really well. So you're not going to feel anything. But what happened is, after the cleaning, you're going to feel some soreness. You're going to give some instruction is learn how to floss and brush correctly, and how to maintain your teeth daily after you eat and after you drink soft drink. You have to make sure you floss and brush. At a dentist, I don't encourage anybody to drink any sugar stuff. It's just not good for your body. A lot of studies indicate that sugar is actually more dangerous than even food contain fat material. So thank you for watching. I hope you enjoyed the video and have a great day, everyone. Please don't forget to subscribe my channel and click and like the video so I can continue post more video if interested in related to my day-to-day dentistry. Okay, enjoy your day. Have a great day. Bye bye.